Chris to buy an ultrasound machine to monitor himself, his baby. Some people say that there are many abnormalities that can be missed by the untrained eye. This is logical. Tom Cruise cannot diagnose fetal or embryo problems. He is not a sonographer. He is not a doctor, but this is not the problem. I know he has enough money to go to the best doctor and the best sonographers in the United States. He is not the reason Chris buy a machine. He want to enjoy his baby with ultrasound. He is not expect to make diagnosis. If you read that, you can see that say ultrasonography during pregnancy should be performed for a specific medical indication and should be discouraged for the sole purpose of viewing the fetus by the mother or determining its sex. That's true, but nobody do. Everybody want to know the sex of the fetus. And also we know also that it's not dangerous. The problem of this, as there are in the commercial area people that make ultrasound by the sole purpose to amusement the father, but also say here there are potential secondary benefits of a medically indicated examination. The secondary benefits is to improve the relation between parents and the future baby. And this is logical. Everybody knows when you're doing ultrasound, you become caring about your son before he born. And everybody do in the hospital. I think that more than 80% of the OB ultrasound in hospital was performed without a true medical cause. It's only to see the baby. The IUM suggests the following: do not prolong studies without reason. In other words, you don't need to see the sex. Don't use time to see the sex. Ultrasonography during pregnancy should be performed for a specific medical indication, and there are no medical indications in normal pregnancy. Why in the United States we perform millions of ultrasound that had no medical indications? Mr. Cruise is right or is wrong. He have the money to buy a machine. He is not producing harm in his future baby that born normally. What is the problem? This is the secondary benefits. You can improve maternal perception, and you also can create a relation between the father and other relative with the infant or with the future infant. They say here educational and commercial demonstration of ultrasound imaging during pregnancy without medical benefits are inappropriate. If that is true, we cannot teach you as we teach. You know everybody that we in the school and in all the school of ultrasound in the United States, we perform pregnancy ultrasound as doing in the hospital without a medical benefit. And of course the word commercial are about people that make ultrasound only for amusement. But in the case of educational, we need to scan pregnant women, and also all the school of ultrasound make protocols in pregnant women. Another time, not confirm a biological effect. Ultrasound, everybody know, is not dangerous. There are a lot of years producing ultrasound and no harm was produced in one patient. Also, the IUM suggests use the less power and the maximum amplification. Also, this is theoretical. A normal power, that everybody use normal power, no harm was produced in 40 years. If you put less power and maximum amplification, you also can lose quality of the pictures, and in general sonographers don't use, but in theory is true. Other precautions are regarded.